los dejamos libres e invitamos a nuestra siguiente invitada. Muchas gracias. Tengo el honor de presentar, yo o Debra, ¿tú lo vas a presentar o la presento yo? Yo presento a Alana. Alana debe ser de las personas con más capacidad ejecutiva que conozco, más función ejecutiva. No me entiende nada porque no habla español, así que no importa. Después le cuentan lo que estoy diciendo, porque ella viene representando a Rare Disease International, a RDI, pero además es quien coordina la Comisión Lancet de Enfermedades Raras, que yo tengo la suerte de formar parte. Y es la que nos ordena. Así que Alana yo la conozco por eso, por la mujer de las mujeres con más función ejecutiva que yo he conocido. Y hoy día nos va a hablar de algo muy importante. Antes de contarles de qué nos va a hablar Alana, esto es algo que mandó Ronnie.
Radar, el canal de las enfermedades raras, es una iniciativa de la Red de Enfermedades Raras de Costa Rica en la que pretendemos llegar a todas las audiencias de relevancia, incluida, por supuesto, la sociedad civil. Entonces los invitamos, este QR los va a llevar a la edición más reciente, la liberamos hoy, a propósito de las actividades que estamos llevando a cabo por la conmemoración del Día Mundial. Totalmente invitados a ver la edición y a seguir el canal. Gracias.
Muchas gracias. Ahora sí, entonces, termino de presentar a Alana. Ella nos va a hablar entonces de tendiendo puentes entre las realidades regionales y la resolución de la Asociación Mundial de la Salud sobre enfermedades raras y las contribuciones que esto puede tener en América Latina. Y ella además no viene sola, viene con un par de amigos que va a presentar en un video. También Chloe Wilson, muy buena amiga, y también me olvidé a quién más va a presentar, pero ahí nos va a hacer una presentación muy entretenida en los siguientes 20 minutos. Alana, bienvenida.
Hola, gracias. I'm very sorry to be speaking in English. I promise next time I come back to this beautiful country and this wonderful region, my Spanish will be better. But I'm guessing some of you will put on your handy headsets and away we go. I'm just waiting for my slides to come up. But today I'll be talking about some global initiatives that are currently underway in the rare disease space, notably the World Health Assembly Resolution on Rare Diseases, which was adopted in May last year, and the Lancet Commission on Rare Diseases, which has just recently been launched as well. Okay, perfect, thank you. Okay, so just really briefly, I think you've seen our logo on the materials today, but just a little bit about our organization, Rare Diseases International. So we're a member-based organization. We represent over 140 rare disease organizations around the world. So some of our members include national rare disease alliances, regional alliances, international federations of certain rare diseases, ultra-rare disease organizations, national organizations that represent one rare condition, and other NGOs that really represent people with rare diseases around the world. We're active in over 150 countries across 6 continents. And in Latin America specifically, we have 2 regional alliances and 11 countries that are represented in our membership. So our vision is really a world where persons living with a rare disease and their families experience a better life through full recognition and support. And our mission is a strong common voice to be a strong common voice for people living with rare diseases and their families and caregivers around the world, and for all the 300 million people living with a rare disease worldwide. We do that by empowering and engaging with the community, shaping global policy, improving access to care, and all that with the aim of improving equity for people living with rare diseases around the world. Okay, so now I'll talk a bit about the World Health Assembly Resolution and the Global Action Plan for Rare Diseases. So the World Health Assembly Resolution on Rare Diseases was adopted just last year in May 2025 at the 78th World Health Assembly. It was led by Egypt and Spain, but it was co-sponsored by 41 member states around the world, which is a lot. And 11 of those member states were actually from the Latin American region, which is really incredible to see the support at the government level from this region. And it was also supported by a coalition for advocacy for rare disease equity, which included over 275 civil society organizations that came together to voice their support for this resolution at the community level. So what is the resolution? What does that mean? So World Health Assembly resolution is really a policy tool that is unanimously adopted by the World Health Assembly. So that means all 193 UN member states agree that this document is an important tool to be adopted by the World Health Assembly. This one is really focused on rare diseases, and it calls on member states to take certain actions. So in this, it's an 8-page document. I invite you to read it if you haven't, but it provides a lot of background, and then it provides 4 pages of actions that are really calling on the member states to do certain things. So the resolution is calling on countries to integrate rare diseases into their policy and planning at the national level, strengthen their healthcare systems, improve quality of life for people living with rare diseases and their families, raise awareness for rare diseases, enhance research activities, and promote equity. And these are all very detailed in the resolution, that member states are expected to do this and report back to the World Health Assembly on their progress in accomplishing these activities. The resolution also requests some actions from the World Health Organization. And this is sort of the biggest ask, is that it asks the Director General of the World Health Organization to develop a global action plan on rare diseases. And that is meant to be developed in collaboration with all relevant non-governmental organizations and academic institutions and civil society. So what this global action plan means is it will really be a document that provides a guiding framework for countries to improve the lives of people living with rare diseases. So these are some of the things that could be included in the global action plan as the WHO develops it. So it might talk about a global diagnostic framework, provide methods for standardizing referral pathways, integrating rare diseases into healthcare systems, how to share expertise across borders, international collaboration, encouraging, the creation of registries at the national and regional levels, capacity building by training healthcare professionals, and really providing that equity lens to ensure that patients in low and middle income countries are brought up to the same levels as other countries. We don't know what the global action plan will look like. That's the WHO that will develop it, but these are some of the pillars that will likely underlie that global action plan. So this is an example of another global action plan, which was released a few years ago on epilepsy and neurological disorders. So just to give you an idea of what a global action plan can look like. So for example, on the right, you'll see it says by 2031, countries will have increased service coverage for epilepsy by 50%. That's a very specific target. And these are the kind of things we can expect to see in the global action plan. So it'll give a date, it'll give a very specific timeline, specific target that countries are expected to meet. And this is sort of the process for developing that global action plan. So the resolution was adopted in 2025. The WHO has 3 years to develop that global action plan. So in 2028, the WHO will need to come back to the World Health Assembly and present their draft global action plan. And then the World Health Assembly at the time will adopt it. And then in 2028, it's a 10-year global action plan, so it'll span until 2038. Every 2 years, the member states will come back and report on the progress they've made in implementing the resolution and in implementing the global action plan. So we can expect that first progress report to come in 2028 and every 2 years after. Each country will have to come back and say what they've done to implement this. So that's a really powerful policy tool. Where are we right now? The WHO Executive Board met just a few weeks ago, early February, in Geneva. And what the WHO Executive Board means is it's I think 27 of the member states that formed sort of the executive committee, which determines what goes to the World Health Assembly. At that executive board meeting, the Director General of the WHO presented a report outlining the progress that the WHO has made so far in implementing the World Health Assembly resolution on rare diseases. However, in that report, they did not mention anything about the Global Action Plan development. So they haven't mentioned if they're going to start consultations. They haven't mentioned anything about the timeline or really anything at all. So that was an important opportunity for member states and civil society organizations to come forward, make their voices heard at this meeting to say that the Global Action Plan really needs to be a priority moving forward and that the WHO needs to take action on this. So we heard a lot of strong statements during the executive board. Rare Diseases International made a statement for all the member states to hear, voicing our support for the Global Action Plan. On the bottom right, you can see Spain delivering a statement. So that's the Minister of Health of Spain, who delivered a statement on behalf of all the 41 co-sponsors of the resolution. voicing their support for the Global Action Plan on Rare Diseases and urging the WHO to take action and develop it without further delay. So that's where we are now. We're really awaiting further instruction on what's to come for the Global Action Plan and see how we as civil society can contribute to that development, how we can lend our expertise. But until the WHO comes forward, we don't know what that will look like. So right now we're preparing the community to get that input ready. Okay, so now I'll talk a little bit about the Lancet Commission on Rare Diseases, and then I'll come back to explain sort of what this means for the regions around the world and how you can make sure your voices are heard in each of these initiatives. So the Lancet Commission on Rare Diseases is one of many Lancet commissions. And really this is an initiative that started many years ago. The Lancet, the scientific journal, started launching these commissions to bring together experts around the world to solve a really crucial health issue. So our commission was launched in February 2025, just over a year ago. And it really presents an opportunity to address the needs of people living with rare diseases and advocate for the inclusion of rare diseases in healthcare systems around the world. The aim of the Lancet Commission is really to highlight the challenges that are faced by people with rare diseases and really provide tangible solutions for an equitable and effective rare disease ecosystem. So in the end, about 2 years normally, the Lancet Commission will publish a report. And that report will provide recommendations for all stakeholders around the world, so government, policymakers, but also academics, clinicians, researchers, patient organizations, so recommendations to all stakeholders and a real call to action, which will in turn also inform the development of the Global Action Plan. And these recommendations are meant to be applicable across all countries. Okay, so this is just to show you all the expert commissioners that we have on the Lancet Commission for Rare Diseases. I've highlighted in orange border, you'll see all the ones that are based in the Latin American region. So we have, of course, Dr. Francisco, Dr. Jose, who's based in Mexico, Dr. Ignacio Zarante, based in Colombia, and Dr. Roberto Giuliani, who we heard from earlier from Brazil. And all the other commissioners, all regions around the world are represented. This is just some of the generous people who have helped to support the Lancet Commission on Rare Diseases. So we've received support from the Fondation de Luxembourg, the Hong Kong Genome Institute, who hosted our most recent in-person meeting in Hong Kong in November, the Harriet Joyce Foundation, and AFM Téléthon, which is a group in France. And they have all been really interested in the work being done and have offered support for the commission to enable it to do its work and meet in person. So we're very grateful for that. So just a little bit about what the Commission is trying to do. We know that despite really significant advances in medical science, research, and clinical care recently, people with rare diseases still experience prolonged diagnostic odysseys, limited treatment options, and inadequate access to care. I think that's been clear from everything we've heard today. So we really need a comprehensive understanding of these challenges around the world and how they differ from region to region and country to country in order to then devise strategies that bridge these gaps in research, funding, policy, and healthcare delivery. So the idea is really to bring together these leading experts in diverse areas of expertise to make evidence-based recommendations to transform the rare disease landscape globally. So the vision of the Lancet Commission is that rare diseases are visible globally. That's the one gap they're trying to achieve, or the one gap they're trying to solve, is to make rare diseases visible. That's the key word they've chosen. And their mission is that rare disease is a priority in health, education, society, and research globally, and really aiming with a focus on visibility and recognition of rare diseases. Their reasoning was that there's a lot of challenges we can tackle in rare diseases, but they all stem back to the fact that rare diseases and people living with rare diseases are not always visible across the ecosystem. And if we can start there, then everything else can trickle down from there. Okay, so once they chose their gap that they're trying to accomplish, they split up into 5 working groups. So now all the 26 commissioners are sort of divided among these 5 working groups. The first one is on visibility for human rights. The second one is on visibility for social justice. The third is on visibility in data and metrics. And the fourth is on visibility within the health system and other sectors. And the last is visibility for clinical pathways, really focusing on treatment and care. And I'll go into a bit more detail about what this means on the next slide. This looks very complicated, but really it's just sort of showing how the different working groups all come together to show one coherent message. So in the blue border around the outside, you can see the different human rights being represented. And that really provides a frame for everything that's happening within the Lancet Commission. And then you can see on the left-hand side is about counting rare diseases, data, coding, how do different countries use different codes for rare diseases to make sure that people living with rare diseases are seen within the healthcare system. And then in the circle on the right is sort of where the other three working groups come in. So we have the societal care pathway. Are people with rare diseases living well? Are they receiving social justice? If not, what are the barriers to that? Why is that happening? The clinical care pathway. Are people living with rare diseases receiving access to care, access to treatment? Are treatments being developed? What are some of the barriers to innovation? And then the diagnostic care pathway. So what is a diagnosis? What does it mean to have a diagnosis? Why is that important? What can a diagnosis for a rare disease change within not only a patient's life, but also in the healthcare system? And then how does this all work together to make rare diseases more visible? And that's sort of the idea of the Lancet Commission. And really where they are right now, so like I mentioned, they met in Hong Kong in November 2025 for an intensive 2-day meeting to really move forward within their working groups and within the commission as a whole. And so far, they've made a lot of great progress in sort of mapping where we are in rare diseases right now. And now where they're moving toward is building that big, bold vision about how rare diseases can be visible. So what does that mean? What does that look like that rare diseases are visible? What is an ideal world? And what are the cautions? What are the risks in that? So for example, if we take one rare disease today, what could it look like in the future if things are done well? And we know that the Global Action Plan on Rare Diseases that I mentioned previously is going to be a 10-year action plan, so it'll run until 2038. So what could the world look like in 2040 if we really put our heads together and the system works as it's supposed to? And these are some of the next milestones. I won't go into them because I know I have 5 minutes left. But just thinking sort of forward, we're working on finalizing the working group contributions. The idea is to have this final report of the Lancet Commission published early 2027. And then when that report is published, it's not the end. We'll have to disseminate the report to ensure that it actually has an impact around the world and it doesn't just remain a scientific paper online that nobody reads. So that's what RDI is working on with the Commission, is to ensure that the Lancet Commission is profiled, that people are interested, and that when that report is published, people read it, the people who need to read it. So I've talked a lot about these high-level international initiatives, but what does that mean here in Latin America or in the other regions? How can you interact with these initiatives, and what do these initiatives mean for you? So these are my last few slides. So just thinking back to the resolution and the Global Action Plan first, say we take 3 different countries, for example. One is a high-income country that already has a national action plan on rare diseases. However, we know that there's still delays in diagnosis, especially in rural areas. So one example from that the Global Action Plan could have is to improve training and awareness for primary healthcare providers to help reduce those diagnostic delays. In another country that might be a middle-income country, they have a national action plan for rare diseases, but they don't have much data. They don't know how many people actually have a rare disease in their country. So this resolution and Global Action Plan could actually help encourage the development of a national registry. And if we take sort of a low-income country, for example, they don't even have a national action plan on rare diseases yet. Access to treatment is really limited. Maybe the resolution could come help by providing support for innovative funding models for rare diseases to help improve access to medications. And I think the common line in all of this is that the WHO will be providing guidance and support to all member states around the world. So any member state can go to the WHO and say, we need help. We know there's this resolution. We don't know what to do. And the WHO provides them guidance. The resolution also prioritizes rare diseases in the public health agenda, and it provides a justification for dedicated budgets for rare diseases in national health budgets. So I think the bottom line is it's a really powerful advocacy tool that is meant to be used. This slide just sort of shows this big ecosystem that's happening now in engaging for the resolution. So Rare Diseases International, obviously we operate at the global level. So we're in contact with the WHO, we're advocating with the WHO to ensure that things move forward at the global level. And recently we formed these regional task forces. The Latin American Task Force has been very active so far, and they're sort of the liaison with member organizations and other civil society organizations at the grassroots level, at the community level. So all these sort of global, regional, national levels are working together to ensure that all the voices are heard in this global action plan development, to ensure that all the perspectives are taken into account. And when the WHO officially starts developing it, we'll have our input ready to say, these are the pillars that we think should be in it. And the WHO will do with that what they will, but at least our voices will be heard. To ensure that we have a strong collective voice for people living with rare diseases that's cohesive across the region, and it provides insight into these local realities. This is my last slide, just about, so what about the Lancet Commission? What does that mean at the regional level? Why should you care about the Lancet Commission on rare diseases? So we have 26 commissioners from across all continents, like I mentioned, and these 26 commissioners come from diverse perspectives and expertise. So we have health economists, we have clinicians, geneticists, biostatisticians, pediatricians. So all these diverse areas are coming together with knowledge of their local challenges. And that is sort of working through a holistic and a multidimensional approach, looking at all the different facets of rare diseases in the ecosystem, which we hope, the goal is that it will produce robust, evidence-informed data sets. So they're going to produce new data, which will be really key in advocacy. And most importantly, that final report will provide recommendations that will be implemented around the world according to local realities. So the recommendations need to be applicable across all countries that can be adapted to the different realities in each country. So look out for that report when it comes along, follow along to what we're doing, and I think this report will be really important, an important advocacy tool as well. I think I have just under a minute left. So I've talked a lot, but I am from Rare Diseases International. I do not live in the Latin American region, so I think it's important for you to hear from people who have more experience with these Lancet commissions and sort of the impact that they can have. So I have two very short videos, and then I promise I will get off the stage. So the first one is from Dr. Chloe Wilson. She is our liaison at the Lancet, and she has been involved with many, many Lancet commissions. So she's seen their impact firsthand. And she has a short video sort of for this event explaining the potential of our commission. So I will let the control room queue up the video. I see a thumbs up. So hopefully it should start playing in a second here.
Hello, my name is Chloe Wilson, and I'm a senior editor at The Lancet, working on the Commission on Rare Diseases. I'm so sorry I'm not able to be with you in person today, but thank you so much for the opportunity to record this video. As many of you will know, The Lancet has a long history of establishing commissions, and those commissions bring together leading experts, stakeholders, as well as communities to address some of the most critical issues in health. A really good example of a Lancet commission is the one we had on diagnostics, and that played a really pivotal role in putting forward recommendations with the aim of accelerating and transforming access to diagnostics globally. Now, the success of commissions lies not only in the report, which brings in new data as well as synthesizing work which has been done across the field, but it's also very much in their ability to elevate and inspire action on the topic. For rare diseases, visibility is going to be especially important. Many patients and families often feel overlooked or misunderstood, and a dedicated commission, we hope, might be able to bring about change through raising awareness, fostering collaboration, and influencing policy priorities, identifying what the challenge is within rare disease, thinking about the change that we'd like to see, and then putting that into action through the work of the Commission. At the international level, commissions can set the stage for global reforms, encouraging cross-border research, innovation, as well as resource sharing. Regionally, they can help tailor solutions to a specific healthcare landscape. And at the national and local levels, they can really serve as catalysts for policy change, guiding healthcare systems to better serve vulnerable populations and address unmet needs. The upcoming Commission on Rare Diseases focuses on increasing visibility, highlighting the challenges in diagnosis, as well as the challenges this brings for millions of people affected by rare disease worldwide. We really hope the Commission is going to be a powerful driver for raising awareness of these challenges that face the community worldwide, and will drive meaningful change in how we recognise and establish policy action in rare disease that will lead to better outcomes for the whole community. Thank you so much.
But basically, just to summarize Dr. Wilson's message, she's just saying there's been a lot of commissions that have been really successful at national, regional, global levels. For example, there was a Lancet Commission on Diagnostics that she mentions in her video, which came out with really clear recommendations for how to improve access to diagnostics around the world. And countries at the national level really ran with those recommendations because they were specific, tangible, and actionable across all countries. So her hope is that our commission will have the same impact at all the levels as well. And unfortunately, I imagine we'll have the same issue with the next video. It's a shorter video, and it's in Spanish. But this one was from Dr. Ignacio Zarate, who is one of our commissioners, like I mentioned on the previous slide, based in Colombia at the Instituto de Genética Humana, based in Colombia. I'm assuming this one will not work either, but maybe I'll just summarize the video and we can share it after. But we asked Dr. Zarate to record this short video, so sort of what impacts the Lancet Commission can have for Latin America. And he talks about sort of the unique challenges that exist in this region. And he assures, that there's 4 commissioners on this on the Lancet Commission, which are really speaking on behalf of this region, making sure that the perspectives from their countries are taken into account. Obviously noting that some countries in this region don't have the same realities as countries in Europe or countries in Asia, for example. And all of that will come together to produce recommendations that will really make change at this level. So sorry about the videos. I hope we can distribute them afterwards so you can listen to them on your own time. But thank you for your attention, and I hope that the Global Action Plan and the Lancet Commission will make real change in the region. Thank you very much.